Thank you, Betsy. Thank you, Zoom. All right, we do have a sponsor for today's event. Virginia Mason Franciscan Health is our presenting sponsor, and our partner in all of these in this webinar series is Business Health Trust. So thank you to them for allowing us to present this content to our members and non-members for free. So with that, I will turn it over to our moderator, Markham McIntyre, Executive Vice President at the Seattle Metro Chamber, and he'll lead us through the rest of the program.
Thanks very much, Lee. Really excited about today's presentation. Hopefully we get a lot of good questions. We're first going to hear from Shannon Braddock, who's the Deputy County Executive for King County. She's going to give us an update on some policy matters and kind of where the order stands. Then we're going to hear about the state's new MyIR product that helps with proof of vaccination, and then also our friends from Clear, who also offer a product for proof of vaccination. So as we get closer to the October 25th deadline of the order going into effect, we want to make sure that we're providing as many tools as possible to make complying with the order as easy and as simple as possible. So with that, I'm going to turn it over to Shannon Braddock, Deputy County Executive for King County. Welcome, Shannon.
Thank you, Markham, and I appreciate the promotion, but I'm actually the Deputy Chief of Staff to the County Executive, so I will clarify that for this group. But thanks everybody for having me here today. I know you all have been receiving a lot of great information through our chamber partnerships, and really appreciate all of our stakeholders, community stakeholders, and many of you here helping us to fine tune our local health order. So I'm here to share a few updates related to that order. Thank you, Lee. I think if you want to go to the next slide. Last we spoke, we talked about how we were going to change a few things in the actual order to better meet our intent and to meet some of the stakeholder feedback we have been hearing. So this is just a few of the things that I think are most notable and sort of less technical. So the first one here is related to the language that was in the original order that said that vaccines needed to be checked prior to entry. We have pulled that language out, and it now just states that they are fully vaccinated. It is required that they show they are fully vaccinated, but we don't speak to whether that needs to be before entry or, for example, when someone is sitting down to be served at a restaurant or something. So operationally, we're trying to make that so folks can do that to whatever works best in the kind of business format that you all have. Second, we've included and called out gyms and fitness facilities in the new order. And those are gyms and fitness facilities that are open to community and open to the public, not for membership things. So a private gym would be included in that. But for example, if you have a gym in your condo facility that only people who live there use, that one would not be included. We have clarified that all school events and activities are not covered under this order, not just school sports. So for example, if a field trip is going to a location like the Flight Museum, they would not need to do vaccine verification check on that school field trip. And then another piece is related to rapid tests. So one of the things that folks can do is there is a 3-day period of time where if they do not provide a vaccine verification, they can provide a proof of a negative test within 3 days of being in whatever location they are going that is covered under this order. And we are now including in that rapid tests that are provided by a health provider or a pharmacy, so basically that are third-party verified, are an acceptable test. It does not just have to be the PCR test that we were previously accepting. It cannot be, however, still a test taken at home. So people can't just come and bring their home test as proof. They're off-the-shelf home rapid test. So those are some things that within the order we have actually updated. And I believe that updated order should be in the toolkit now and on the King County website as well. So another space, Lee, if you would be kind enough to go to the next one, is that we are still actually, it is an evolving document, updating our frequently asked questions. We are obviously trying to get it totally solid before we implement on the 25th, but we are continuing to try to hone in to make them more and more clear to the best of our abilities. So again, we really appreciate the clarity that many stakeholders have provided in this space. So here's just a few examples of some areas where we are updating that information. One is for the mobile and digital vaccine verification options. We actually have added an FAQ, a question that is, what digital vaccine card apps can individuals and businesses use to verify vaccine status? And we provide in there that DOH recommends MyIR Mobile. And of course, you'll hear about that today. And that people can choose to use additional vaccine card apps such as Clear or something called COVID Proof to provide vaccine verification. So I know we'll also be hearing from Clear today as well. So we've provided a little more in that space on our frequently asked questions. Again, we've clarified about the rapid tests as I just described. We had yesterday a really helpful webinar with our hotel partners. And so we're going to create some new FAQs related specifically to hotel spaces. And then another one that was interesting that folks brought up, which was super appreciated, was 12-year-olds and the reality that some 12-year-olds may have just turned 12. So how should folks manage that? So our response there is that if they are with an adult who verifies that their vaccine is underway, so if they've gotten their first shot or, and they're working on getting their vaccine, that is enough to go ahead and let a newly 12-year-old qualified person into the space, and that we will, as long as they are with an adult who attests that they are in process for getting their vaccine. So in essence, trying to provide a little bit of grace for those folks because that one is a bit challenging. So those are some areas where we really just tried to update based on some of the feedback that we have heard. You'll see there are many other sort of clarifications and updates within the FAQ document that may have been changed since you all last saw it, but obviously we're trying to continue to make it as clear as possible and provide that clarity for folks who are really, especially in some of these gray spaces. So I've really appreciated the partnership of everyone here to help us do better in that work as we're trying to implement our verification plan and keep our communities as safe as we can and slow the spread of this COVID virus, and hopefully get back to business as close to usual as we can. Our goal, as we've stated, is to really try to have businesses be able to operate at capacity. And so far, we're feeling like we're on the right track for that. So really appreciate all of your partnership in that space. And that's really it for the things I wanted to highlight today, but I'm happy to answer any questions.
Thanks very much, Shannon. Really appreciate the update. And very much appreciate the partnership with King County and Public Health throughout this whole thing, just being available for questions and coming and do these presentations and just being very transparent about how this is all happening. And also with the stated goal of trying to keep everyone healthy, but also trying to keep businesses open. Really appreciate that. So there is a question in the Q&A, and if others have questions, please drop them in there. Does the rapid test have to be done by a testing provider on site at the event, or will a rapid test done at a pharmacy be accepted?
A rapid test done at a pharmacy will be accepted now. That is one of the places where we've updated our order and the FAQ.
Thank you. And then since you just mentioned, that you've got this new order, do you anticipate any other changes or updates between now and the 25th when it goes into effect?
I will knock on wood, as I say. We do not anticipate any changes to the order. I do anticipate that we will likely be continuing to update and clarify some of the frequently asked questions. So it could impact the toolkit provided by the chamber as we are trying to get more clarity to the best of our abilities. But no, to the order, we do not anticipate any changes.
Great, thank you. I know that in one of the previous webinars, we talked about for like delivery drivers or whatnot, kind of dropping off something at a restaurant or delivering a product to a restaurant, they would not be required to have their proof of vaccination checked. But what about say like a dance studio or a gym where somebody's picking up, say, a kid? Are they going to have to show proof of vaccination to pick up their kid from a fitness center or a dance studio?
No, if they are showing up to pick up their child, and I understand that could mean, mingling for a few minutes while you're waiting for your kid to gather their things. I have 3 kids. I know those things can take longer than one anticipates sometimes. But no, in that case, that transitory action, no. If though they are there to view and they're sitting in the same space and they're staying for the period of time that the child is in the space, then yes. And the child over 12.
Thank you. We've got another question in the Q&A. If renting a room space to a group, is the facility or the group responsible for checking for proof of vaccination?
So we really do leave that to the facility to make that determination. If the facility feels most comfortable being the ones to do the verification work, that's great. If they prefer to have the client using that space, either attest to and or be on site to check vaccine verification, that is also acceptable. We are open to whatever is the most operationally feasible to follow the intent of the order.
For a business like a gym where they have a membership that might be coming back repeatedly, is there a way that they can record a customer's vaccination status and then not have to check it each time that they come back to the business?
Yes, absolutely. That is a space where we didn't want to require folks to have to do that, to create new systems to be able to track it. But if for a business that is a way that works best operationally for them, that is absolutely acceptable. I would highlight that if it is a person who is providing a test, a demonstrated negative test, obviously that would have to be checked again when that person came back to the facility.
And then as we're getting, we're under 2 weeks until the order goes into effect. Can you talk a little bit about how we're going to be talking to the public? We've certainly been talking a lot to businesses and trying to make them aware ahead of time. But what's like the main message that we're trying to send to the public as we get closer to the 25th?
Thank you, Markham. So our really main message is to say to them, we're ready and we're here to help you and the businesses that we hope you will be continuing to patronize, follow this order. So on Monday, we're doing a public announcement that will include the executive and the mayor and some businesses who are excited about our vaccine verification rollout. Our public health teams have been working with doing some social media work, some other work with community-based organizations to get the word out. And so we're just basically doing, a public information campaign through our public health lens, using things that we know have been successful in the past related to pandemic-related things we've had to be doing. So, and you'll just see us reaching out to a lot of partners, trying to ask them to also share this information. And again, as you said, Markham, we've been working closely with businesses and small businesses and all region-wide to try to make sure folks have the resources they need to implement if they are covered under the order.
Yeah, I think if we've learned anything through this whole pandemic, it's that a little bit of patience and grace goes a long way, especially when we're dealing with businesses who are struggling to just make it through the day. So,
yeah.
Another question in the Q&A: will there be county-sponsored free rapid testing sites?
Rapid testing sites, not at this time. We do still have our testing sites that are our PCR testing sites. But no, we are not currently planning to set up any new rapid testing sites.
Okay, we'll pause for a moment and see if there's any other Q&As that come in. But otherwise, thank you very much, Shannon, for coming in and answering these questions.
Of course.
We will put the link to the KC Vax Verified site into the chat so that people can see it. That should have all of the updated information, including the updated FAQ that Shannon mentioned. It's also got the new toolkit for businesses that can help them get ready for the 25th, as well as signage and a whole bunch of other stuff. So pop over there if you have any other questions, but otherwise, Shannon, thanks very much. Really appreciate it.
Of course, thank you. As always, feel free to share questions. Markham and his team do a great job of communicating with us to try to get clarity and information out to folks. So thank you. And I'll be hanging on to watch the rest.
Appreciate that. Yes, if you do have questions, please let us know. We're just like Shannon was demonstrating, we're trying to be as transparent about this whole thing as possible and trying to make sure to answer as many questions ahead of the 25th as possible. With that, I'm going to introduce our next round of speakers for a very exciting discussion about technology and how that can be helpful in helping with the proof of vaccination. So I'd like to introduce Bryant Karas from the Washington State Department of Health and Peter Adler from the Public Health Seattle King County. Bryant and Peter, please take it away.
Hey, everybody, this is Peter Adler. I'll kick this off for just a moment and hand off to Bryant. As King County was in its planning phases for the order that Shannon just updated us all on, we were very aware that in order for this to be successful, it would have to be easy and efficient for people to be able to verify their vaccination status as they entered businesses or wherever they needed it. And that whatever the mechanism or mechanisms were to do that, that they needed to serve needs beyond King County. So they needed to be interoperable, and they needed to be ones which could be used not only elsewhere in the state as needed, but when people traveled from the state or traveled into the state. We briefly, for about 3 seconds, thought about whether King County should develop some sort of technology, enabling technology, and we quickly concluded wisely, I believe, that that needs to be at least begun at the level of the state to be able to do that. And I'm handing this off now to Bryant, who will give us the most current update on the state's MyIR immunization registry, MyIR. And it is really come quite far. And Bryant is the brains behind that. Bryant?
Well, I'm one of several brains that have been working really hard on this. It's been a work in progress for a lot of people, and I think it'll continue to evolve over time. We're going to hope to keep making more and more incremental quality improvements to the process. Can you guys see my screen?
Yes.
All right. So what I wanted to do is in about 10 minutes or less, just kind of walk through what's currently going on with a product that not just Washington, but several states have rolled out, referred to as MyIR Mobile, and which, as was discussed, allows people to get digital access to their immunization registry records. And some of you may have been using MyIR or MyIR Mobile for years. There's some discussion about people with kids and dance programs, after school sports, and Washington State was one of the first in the country to release patient level or parent level access to their kids' immunization registry records. And this is kind of the next evolution of that, taking it to the next level. And if I can figure out how to advance slides, what we've done is, starting on May 4th of this year, we launched some new features within MyIR Mobile that allows you to get a certificate of COVID-19 vaccination. And depending on which series you got or which vaccine you got, it's either complete with 1 dose or was deemed complete after 2 doses. And so that can either be in the form of a simple screenshot with a nice big red-green check, or a red or green check mark on it, or a paper printable record with a authoritative stamp on it. So those two have existed since May 14th. And what's nice about MyIR Mobile is that people can go in and can kind of gather up several different family members' records under one account. So somebody can develop an account in MyIR Mobile, and then people whose vaccines they have record level access to or permission to gather can pull that together. And it's not just MyIR Mobile as a whole has not just COVID-19 vaccines, but you'll be interested to see all of your vaccines over the past years. I was able to go in and see how many flu shots I'd gotten and which years I had missed, which was none, but it was interesting to see how even vaccines that were delivered at pharmacies will be listed in there. What's new and that I want to talk to you about today, and there was some hint at QR codes, is that we've newly are working on adding something that's called a smart health card. And that's a QR code that gathers that information for your COVID-19 vaccines and puts them into a high resolution QR code that can prove and can't be faked that you actually received those vaccines. And it's digitally signed and by a issuing authority. And this is utilizing some secure technology that's based on the Smart Health Card international standard. Smart Health Cards contain, people are probably thinking, well, does that contain a lot of personal health information? It has just enough information to get the job done for proving your vaccine status. It may have your legal name, your date of birth, so that it can be confirmed with an ID, the information about tests and vaccines, but it should not contain any personal information that you wouldn't want to be sharing with a venue that you're checking into. What do you need to get access to these QR codes? People need to have their name, birth date, and the phone number for which they provided when they got that vaccine. So to get registered through MyIR Mobile, you need to be able to authenticate you are, in fact, the person who you say you are. And so one of the common issues are people who didn't provide a phone number, and there's a mechanism for folks to go in and make sure that their phone number gets associated with their vaccine records. So Washington State Department of Health is not the only organization that's issuing these QR codes. Some of you may have noticed your healthcare provider or your pharmacy where you got your dose is offering a mechanism to get vaccine verification. And these are using the same Smart Health Card QR codes as we're using. So they're all interoperable. Epic Corporation and Cerner both are issuing these Smart Health Cards through their patient portal. So you may have an app on your phone called MyChart, and you can log into that and you can get your vaccine information through that mechanism. So there'll be multiple ways, and Washington State Department of Health is, still, issuing the paper human-only readable, which I think a lot of venues will utilize, but we're now also adding these QR codes to the toolkit. And we're getting the word out on social media. So I'll stop there. Any questions?
Thanks, Brian. Appreciate that. Can you remind me what's the timeline for this being available?
So well, MyIR Mobile has been available. MyIR has been available since for the past 5 years. The addition of MyIR Mobile and being able to get access on mobile phones and began this past May. And the addition of these QR codes, I think I'm referring to this as a soft launch. It's quietly launched in the background on September 30th. So we haven't started really publicizing the QR code piece of it, but it is there.
Well, that's exciting. So for those on the webinar, you're part of a very exclusive soft launch, which is always fun. So since we have businesses participating in the webinar, can you talk a little bit about just practically reading a QR code? So like, what's the expectation when a patron comes in and they've got their MyIR and they've got their QR code? What should a business do? How does that work?
Yeah, so I kind of anticipated that was going to be a question, so I put this slide together as a visual, and I think it'll be a good handoff when we hear the next speaker from Clear. I think of this as a three-legged stool, and you have to have all three legs for the stool to stand up. You have to have a trusted issuer that can issue credentials, the vaccine information itself. And that's, to date has mostly been the CDC cards, but now we have DOH and the MyIR mobile as another mechanism, or people getting them from their MyChart from their clinic or their Walgreens or Target or Walmart app. So that's one thing, issuing these credentials. So that has to happen before the business knows what to look for. The holder has to have a way to transport them. And the phone is the most obvious and logical, convenient mechanism for people to carry around these credentials so they don't lose their CDC card. But there is still paper options, both a paper option to carry your CDC card or to print off this smart health card, because that barcode can just as easily be read off a piece of paper as it can off a smartphone. And then for the venue, they need to have a mechanism to inspect it. And that can be in the form of an app that runs on their phone that can read these specialized QR codes and tell whether or not they're valid or not. But I think, as was said earlier in the conversation, what a lot of organizations are doing is a visual inspection, looking to see if it looks legit. Does it have the person's name on it? Is it the same person that they're dealing with, or who they expect it to be, or is the age look like the age that they expect it to be? That visual inspection is what's being used in most cases. And I think of it the same way I think of the Link Light Rail. You don't have to scan your ticket, you just have to have your ticket and be able to show it to somebody. But every once in a while, there's going to be a venue or a situation where it could be scanned. And in that case, you may turn to a more professional system. We'll hear from Clear in a moment about how their solution works out. But there are also some free solutions that are available. There's one that we don't endorse, but point businesses to as a free resource. The Commons Project has a verifier app that it can be utilized to scan these QR codes and to authenticate that that it is a legitimate and approved vaccine dosage.
Shannon mentioned earlier, that in lieu of proof of vaccination, somebody could show a negative COVID test within 72 hours, and that it's okay to do some of the rapid tests so long as there's kind of a third party verifying it. Is there a way on the MyIR mobile app to kind of upload a test result? Just if somebody's, as you mentioned, you can have kind of multiple health records in there. Is there a way to upload a test result as well as the immunization record?
At this time, no. The MyIR mobile only deals with immunization records. It's the IR of the MyIR. So those immunization records, we are exploring other options. I think there was a news article. I'm not divulging any breaking information here. There was a news article. The governor announced a partnership with New York State and California, where we're all working together to look at how to leverage these smart health card technologies. And that multi-state consortium is looking at adding negative test results with it, within 72 hours to our toolkit. But so more on that soon.
And then you said that we're kind of in the soft launch phase. Can you tell us a little bit about when there might be a bigger launch and a little bit more public communication around this for public education purposes?
I think that is in the works. I don't have the exact date when those communications will start hitting the streets. Some of the social media that's more easily disseminated may be happening as we speak, but I think we're trying to align and plan for a readiness for this October 25th timeline that everybody else is.
Great. Thank you very much, Bryant. Really appreciate the kind of peek behind the curtain on my IR, walking through kind of the QR code piece of it, and then how I think this slide is helpful in kind of thinking about who's issuing it, who's holding it, and then who's actually verifying it. Peter, did you have anything you wanted to jump back on and add now that Bryant's presentation is done?
I don't at this point. Just one point of, so nothing to add, but just a point of emphasis, which is the ability for businesses to read this QR code if they choose to want to go down a path of automating it, if you will, and not have to deal with paper, that there are free at no cost to the businesses apps available that will read it, so that it's possible to do this here in a few weeks or now, actually, without the need for businesses to need to invest in infrastructure or IT or to do that. So that's one of the advantages of having multiple options here for VAX verification, that some will come at a cost to read ultimately, and some will be free. And this particular one that the DOH is working on, that Brian just talked about, will be able to be read by some of the free apps. So for some businesses, I know that's a really important variable.
Great. Thank you, Peter. Thank you, Bryant. Really appreciate you guys hopping on. And then we'll try and get more information from DOH about their public education campaign and make sure that we're sharing that out with folks so they know kind of as that communication plan ramps up, what to expect. So this last presentation mentioned CLEAR a number of times. We're going to bring on some folks from CLEAR, Amy Hopshin and Adams Landsman. You might recognize CLEAR from the airports. They've certainly got kiosks there, or perhaps with their partnership with some of our major sports teams. So I'll turn it over to Amy and Adam to talk about CLEAR and how it might be useful for businesses as proof of verification.
That's great. Thanks, Markham. And hello, everyone. Nice to be with you all this afternoon. So yes, certainly, as Markham was saying, right? Like everyone thinks of airport security when they think of CLEAR, but we're so much more. We really think of ourselves as a secure identity company. How do we take your identity, tie that to the things that are uniquely you, and then open up all of these frictionless experiences, whether that's in air travel, hospitality, sports venues, or sort of like a lot of different sort of verticals and whatnot. We specifically want to talk to you guys today about our digital vaccine card, and we'll also touch a little bit on Health Pass, which are two different sort of vaccine solutions that are available. Digital vaccine card is completely free for anyone to use. So, sort of as Bryant as Bryant was sort of mentioning, right, sort of like as, sort of these small businesses and everyone else are thinking about how do I, sort of like comply with the local mandates? How do I make sure that, sort of like I'm checking and verifying, somebody's vaccine status without having to invest in any additional infrastructure? Our digital vaccine card is absolutely one of those completely free apps that is available to anyone, where you can securely link your vaccine to your identity and be able to use that sort of as you're going throughout your day, whether that's walking into a restaurant, a gym, or anywhere else. So with that, I'm going to turn it over to my my wonderful colleague, Adam, who talks about this all day, every day with businesses, large, small, and medium. And we would really love to be able to answer any questions that you guys have as well. Adam?
Thanks, Amy. Hi, everybody. So let me take a quick half a step back and just tell you how we get to the slide that's in front of you, which is really all about digital vaccine card. In order to use Clear, the individual just needs to go through a very simple enrollment process. It's completely free, as Amy mentioned. It takes 2.5 minutes. And it's really important because that's where we confirm the identity of the individual. And so if you are a business or you're wondering how sort of confident you should be in that business that's accepting this type of a solution, the Clear solution confirms someone's identity because they upload a valid government issued ID, like a driver's license or a state ID or a passport. We validate that they have a valid ID. We have them take a selfie, right? So we use their facial biometric and we confirm that that person is the same person on the ID. That is how we lock down that secure identity. This is something, as Amy alluded to, we've done for over a decade in airports around the country. And so at the heart of everything we do, we are confirming that we know for sure who that individual is. And then if you look at the slide in front of you, we have our digital vaccine card solution, which the individual is able to link their verified vaccination information or upload their CDC card. And that then ties their vaccination information with their identity, resulting in the ability for me or you or whomever to essentially walk around with a digital copy of our vaccination information in our pocket. That can then be shown to everywhere, to anywhere that accepts a digital solution like Clear. I'll talk a little bit more about that in a second, but let me just focus on the hows and the whys on the screen. There's actually 3 different methods that an individual can link their vaccination information or upload their card. The first method is through our app. They can select that they would like to link their Clear app with their source of vaccination. So let's just say that I got vaccinated at a CVS. I can select CVS, I log into my CVS patient portal, and I give Clear permission to pull just the minimal vaccination information like dates of shots, manufacturer, locations of shots. And we then have that information and can then confirm that you are vaccinated. You know, obviously we have the algorithms internally that says, okay, 14 days post the date of your second shot, that's when your vaccination starts, you know, through, let's say, a year, unless the CDC were to change those guidelines. The second method, which was talked about on an earlier presentation, is our ability to scan those smart QR codes. So anybody that has a smart QR code or will have a smart QR code, because those people get their booster shots, likely not just in Seattle, but in many other states around the country, they will move to that smart QR code process. And we make it really simple. You just scan or upload that QR code, and that allows Clear to pull in all of the same vaccination information that I just mentioned. And then the third way is the ability to just upload a picture of your CDC card. We do have machine learning algorithms that take into consideration things like, is the logo there? Is the size of the card the right size, and the font and the logos and things of that nature? So it certainly is trying to prevent that an individual might upload a picture of their puppy or their kid. Also, we ask people to take a couple extra steps, like actually confirm some of that information by entering the date of the shot, the location of the shot, the manufacturer. So in any one of those 3 ways, that gives the ability for the individual to add their vaccination information to their Clear record. Once they do that, they have essentially that screen on the right, either the blue or the gray, depending on which path they used, and they are carrying around their digital vaccination information. Now, to talk a little bit about where can you use this, just to give you a sense, as Amy alluded, we've been talking to thousands of folks over the course of the last 18 months. We have at this point several hundred partnerships ranging from large sports venues. In fact, we have partnered with all of the professional sports team in your area. So at T-Mobile Park, at Climate Pledge, at Lumen Field, all of those folks are accepting of Health Pass or digital vaccine card, as well as partnerships with Open Table and Resi. So many restaurants and gyms and other places that will just accept the ability for someone to walk in with the Clear app and simply show them that screen. You can move forward to that next slide. So, sorry for jumping back and forth. I think the last point that I would make, and then I'll kick it back to Amy for wrap up and maybe before we take some questions. The whole concept that Clear continues to follow is we're trying to get people back to what they love, right? Fine, they might need this to get into work. Of course, they're going to need it when they go to a restaurant or a fitness center, as you mentioned, sports, entertainment, conferences, concerts, whatever else might happen over the course of the next however long we're in the situation. And so we want to make it really easy. So just to reiterate again, this is completely free. It doesn't cost the individual anything in order to download the app, enroll, or link their vaccination information. It doesn't cost the business any information for them to accept Clear. They simply can visually inspect it. You saw on the previous screen, there was a QR code. Don't be fooled. You do not need any hardware. You do not need to scan that QR code. We have some additional services where some of our sports partners want to tie that into a ticket. And so they're scanning that for other purposes, but nonetheless, free solution for the masses. If anybody has any questions, we're happy to answer them, but I'll kick it back to Amy for any final words.
Thanks, Adam. You do that so much more concisely than I ever do. It's wonderful.
I do it 20 times a day.
The last thing that I would mention is, sort of we have been putting together resources, particularly focused on small business owners who are, just trying to figure out how they're going to comply with some of these local mandates as they're rolling out. Sort of like Clear has been fortunate to, sort of we're a New York City based company. So we've been working with Mayor de Blasio and the city of New York. They were the first really large city to implement one of these local mandates. We've been working with them since early August. San Francisco, Los Angeles, and now sort of Seattle and King County. So we've seen how this has worked as people, as these mandates are getting implemented. We've learned some of the pain points for sort of businesses, large, small, and medium, and what people really need and use. And so if anyone ever, sort of has any questions or just sort of like want to reach out, we can put our contact information, and certainly Lee and Markham, they know how to get a hold of me, so they can share that information as well. Additionally, sort of like we're sort of like really kind of leaning into this idea of like helping everyone come back better. And so, sort of like for anyone that is, sort of like a small business and they're looking to show that, sort of like how they're encouraging folks to sort of show that they have a vaccine, or just sort of showing, sort of like that they accept, sort of the Clear digital vaccine card. We have some real kicky little window clings that are available to anyone that wants them, that they can put in their window. I'd be happy to share those with anyone that's interested.
So there is a question in the chat. Do you want me to just jump in and answer it? I can. The question from Brian is, what is the timeline for Clear to display the VCI smart QR code rather than your regular QR code? To give you a more simple answer, the QR code that we display is a little bit different. That QR code is actually confirming that that is a valid and current health pass or digital vaccine card, right? It is not oversharing the actual vaccination information for someone to scan. That gets into a little bit of the privacy, like, do you need to actually share some of that finer detail with a restaurant or a venue? Most folks at this point would say you don't. And just to be clear, our app can scan the VCI smart QR code that allows us to pull in all of the vaccination data, but we then don't sort of show that on an outward facing app.
Thanks, you two. And thanks for that clarification, Adam. One of the questions we've been getting a lot of is, King County is a popular destination for travelers. Certainly as the pandemic goes through its waves, we're continuing to expect kind of visitors to start coming in. What can Clear do for folks who maybe got vaccinated internationally and are coming to visit us? Is that something that you guys offer as part of your digital vaccination card product?
Yeah, great question. We're exploring that right now. We likely will expand to start accepting international vaccines. For now, as of right today, it is only the US, the CDC approved vaccinations. So stay tuned for that. But of course, we are certainly eager to do that, to expand the use case for people to use this depending where they were vaccinated.
I know that San Francisco has a similar vax verification policy, and they went a little bit ahead of us. And you guys have been doing a lot of work down there. Can you just talk a little bit about how that rollout's gone? Any kind of challenges or things that you've learned during that might be useful for businesses here?
Yeah, sure. So the city county of San Francisco, they adopted their vaccine mandate. It was, I think, late August when they adopted it. I think probably the hardest thing for them is they had the most stringent implementation timeline that we've seen of all of the large cities that have gone this route. Whereas sort of King County is taking, I think, sort of six weeks plus for like towards full implementation, when everyone sort of really needs to be abiding and sort of showing their vaccine card. I think San Francisco gave them a week. So it was a really tight turnaround. I think that a lot of businesses sort of struggled with kind of like how quickly they had to come up online with that. But I would say one thing that I've definitely seen that has been very successful in San Francisco, that certainly seems to be the model that Seattle and King County have really been following and adopting too, is how closely the chamber and the local government have been working together to make sure that the business community is really supported and they understand. And sort of webinars such as this and everything else, I think has really was very successful down in San Francisco, and I think that it's going to have a similar effect in Seattle as well.
There was a question that Shannon answered in the Q&A, and I just want to highlight it because I do think it's important to keep kind of hammering this point. Are businesses required to scan the QR code, or is visual confirmation of the QR code enough? And Shannon answered that visual confirmation of the QR code isn't adequate. So if they're just pulling up the app and showing the QR code, that's not quite enough. Can you guys talk about what, I know it's hard without having the app right there, but like, what does it look like when somebody needs to show kind of the full information of their digital vaccine card?
Well, thankfully I have the app right here on my phone with me. So
how convenient.
So here's what my vaccine card looks like when I pull it up, and you guys missed, sort of when I wasn't on video yet. I did, sort of my selfie verification. So it's, sort of like a quick check that like, this is my face, this is actually Amy, and this is what you get. So you see a barcode. If you click on this button here that says view details, it's going to give you all of the very specifics of all of my vaccination. And that's going to be the case. So I went through, sort of the manual CDC card upload because the hospital where I got vaccinated did not otherwise provide, sort of like a digital credential. But let's say that I had a smart health card either from my IR Mobile or from the state of California or New York or any of these other states that have already sort of implemented and rolled out the smart health card, sort of like you would see the exact same thing. And it would also have that view details button where you can click through and show sort of like all of the specifics to verify that, sort of like you're good to go and you have in fact received your 1 shot or your 2 shots, depending on which vaccine you received.
And one thing, Amy, if you could just show, since you have your screen up, prior to pressing that button, and I know it's small, but on the bottom, right below the QR code, you might need to really get in there once it gets back to that screen. It does say, maybe Amy, you could just read, there is a line right above, and it does confirm that is a COVID-19 vaccination record.
It
so
does
again,
in fact say COVID vaccine, COVID-19 vaccination record right there.
That's helpful. There's a question in the Q&A. Can you please review the Clear Open Table integration and how that works for restaurants?
Yes. So we have partnerships with both Open Table and Resi. And so it was designed it is available for any restaurant that is on either of those apps networks. But really specifically designed for sort of like the restaurateurs and the business owners that are based in these cities and states that are being required to check somebody's vaccination status. As you're making a reservation on Open Table, if it is a place where sort of like digital or like proof of vaccine is required, there's going to be sort of a link right there on the Open Table home screen that is going to say, sort of click here to get your sort of proof of vaccination is required. Click here to get your Clear digital vaccine card, which is both a way to sort of like give people a heads up that they're going to need that and make it really easy for your diners to sort of get that set up so that they're good to go before they're walking into the restaurant. And it's the exact same thing with Resi. It's the same partnership, just 2 different apps.
You mentioned that you might have some materials for businesses to be able to communicate to patrons. But is there any other kind of technical assistance that you offer? Is there an email form or a hotline they can call if they've got questions or want to follow up with you guys? What's the best way to get some more information about Clear and what you provide?
Yeah, several ways. Well, first of all, for folks who are not yet Clear members, they can go to our website, clearme.com. They can easily navigate to either Health Pass or digital vaccine card, and there's a host of information there. If people are interested in actually using this for business, digital vaccine card, as we talked about, is completely free. There's really, there's no account to set up. They can just use it. If they want to contact us to get some marketing materials so that they can use and send out, of course, we're happy to. We didn't talk too much about Health Pass. There's sort of another similar but more robust solution. A lot of times employers would use that if they wanted to do things above and beyond just confirming vaccination status. So there's more information there, and certainly someone can submit a form to us and we'll have someone from the team reach out. Additionally, if someone wanted to, if they had already downloaded the app, if they had any questions about how to actually use it, we have 24/7 customer support. They can always reach out to us and we'll help them with, I can't get my vaccination card to upload, or I'm not sure where to go, or I'm at the app store and I'm stuck, right? We'll be able to walk them through all those problems.
Yeah. And I just dropped a URL into the chat so that everybody can see that. That'll take you to sort of our special sort of microsite that sort of will walk you through. Are you a small business? This is what we recommend. Are you a really large business? Here's what we would recommend. And that's really going to help you get to what you need.
Fantastic. Any last remarks from either of you before we wrap this thing up?
Just thank you for having us on today and allowing us to be a part of this.
Adam,
Yeah.
Amy, thank you very much. Really appreciate it. Also want to thank Bryant from DOH and Peter Adler from Public Health Seattle King County, as well as the always awesome Shannon Braddock from the County Executive's Office. I also want to thank our sponsor for today, who is Virginia Mason Franciscan Health. Really appreciate you guys continuing to support the We Got This webinar series. We're a little under 2 weeks out until this order goes live on the 25th. You can expect a lot of communication from the chamber, from our wonderful partners, Southside Chamber and One Redmond and One East Side, as well as a lot of the other business associations, community-based organizations, and local governments, just to make sure that as many businesses as possible know about this. And those that are going to be impacted by the order understand that we've got some great tools and resources to make complying with the order as easy and as simple as possible. If you have further questions, please don't hesitate to reach out to the chamber, and we'll make sure to try and answer those as quickly as possible. Otherwise, we'll give you 4 minutes back in your day. Thanks very much for joining us, and talk to you soon. Take care.